We are going to move on to the Bangkok newspaper in Thailand. In this article, they actually discuss new medical reports that show how your brain or your other organs outside of your lungs also are affected with the virus. So let's get into these two articles, share a few facts or findings, and then let's hear your thoughts. Confusion, seizures, strokes, how Convid may affect the brain. So there's your brain, okay? Okay, so in Washington, a pattern is emerging among the COVID-19 patients arriving at hospitals in New York. Beyond fever, cough, and shortness of breath, some are deeply disoriented to the point of not knowing where they are or what year it is. At times, this is linked to the low oxygen levels in their blood. But in certain patients, the confusion appears disproportionate to how their lungs are faring. Jennifer Fortuna, a neurologist at the NYU Leonard Brooklyn Hospital, seeing these patients, told AFP their findings were raising concerns about the importance of the coronavirus on the brain and the nervous system. By now, most people are familiar with the respiratory hallmarks of the virus disease that has infected more than 2.2 million people around the world. But more unusual are the signs of surfacing about the new reports from the front lines. A study published in the Journal of American Medical Association last week found that 36% of 214 Chinese patients had neurological symptoms ranging from loss of smell and nerve pain to seizures and stroke. Well, let's keep in mind they're Chinese, and China could have done many things to them. A paper in the New England Journal of Medicine this week examined 58 patients in Strasbourg, France, found that more than half were confused or aggravated with brain images surfacing inflammation. Inflammation means swelling up. You've been hearing this that is a breathing problem, but it also affects what we most care about, the brain. If you become confused, if you're having problems thinking, those are reasons to seek medical attention, he said. The old mantra, don't come in unless you're short of breath, this probably doesn't apply anymore. Viruses and the brain. It isn't completely surprising to scientists that the SARS-CoV-2 might implement the brain and nervous system, since this has been documented in other viruses, including HIV, which can cause cognitive decline if untreated. Viruses affect the brain in one of two main ways. Now, explain Michael, a neurologist. One is by triggering the abnormal impulse response known as the cytokine storm that causes inflammation of the brain, called autoimmune neuromyelitis. The second is a direct infection of the brain called the viral affiliation. How might this happen? The brain is protected by something called the blood-brain barrier, which blocks foreign substances but could be breached if compromised. Yeah, the blood-brain barrier is pretty hard to breach, so it is surprising that this can break through. However, since loss of smell is a common symptom of the coronavirus, have some hypersized, the nose might be the pathway to the brain. This remains unproven, and the theory is somewhat undermined by the fact that many patients experiencing amnesia don't go on to have severe neurological symptoms. In the case of the novel coronavirus, doctors believe, based on the current evidence, the neurological impacts are more likely to result of overactive immune response rather than brain invasion. To prove the latter is happening, the virus must be detected in the cerebrospinal fluid. This has been documented once in a 24-year-old Japanese man whose case was published in the International Journal of Infectious Diseases. The man developed confusion and seizures, and imaging showed the brain was infected. But since this was the only known case so far, the virus test has yet been validated for spinal fluid. Okay, and they say they can't do spinal fluid later in the article because when you're on a ventilator, which these people are in a coma, it's very hard to pull the stem cells out of the right proper portion of the body. So they have a hard time gathering the research to do it. But what do you think about this? What do you think about these findings? How about the lifetime effects of recovering from an illness? So whether it's Convid-19 or maybe it's multiple sclerosis, maybe it's arthritis, maybe it's AIDS, maybe it's cancer or whatever. How has have you had an illness that you had recovered from, but it left you with a physical or external body, internal or external body damage? How did it change your life? Like, I had a friend, she got seizures because of a head injury. So she could no longer drive, and she had to be confined, had to have a helmet wherever she went. So that changed her life. You know what? We're going to read one more article while we're on this. Not just lungs, Convid-19 can damage others. So this one actually came from Seoul. Like I told you, there was more than one article. South Korea reported that over the weekend, the first case of heart disease linked to the virus infection, suggesting that the virus, most known for causing respiratory disorder, may also be a wider spectrum of complications. In Daegu, Korea's worst affected city, with 64% of the total viruses, tallied 21-year-old woman without previous medical conditions. So she got a heart virus. The young patient initially exhibited typical symptoms of the virus, including a cough, sore throat, fever, diarrhea, but she was confirmed as a mild case in late February. But around 3 days after being diagnosed, she started experiencing worsening breathing difficulties and had to be taken to the intensive care unit. The university hospital, a carnivorous-only hospital for severely or critically ill patients. Upon the MRI, X-ray, and CT images, her chest showed signs of infections in the lungs as well as the heart, Kim said in a phone interview. Her chest scans revealed an enlarged heart and patterns of the viral ammonia, such as ground glass oplet, she said. Well, enlarged heart, doesn't that mean you're full of love? Her cardiac size, less than 50% of the thorax in a healthy person, was estimated to be about 65%. Well, we need to give this heart to the Grinch who stole Christmas. He said, explaining that the disproportionate cardiac ratio means that her heart's ability to pump blood had been compromised. She was hospitalized for a month, about a fourth of which was spent in intensive care. Although she has since recovered, the extent of the cardiac damage from the virus may prove long-lasting, he said. Okay, and so again, this one goes into how your heart and now your brain can be affected. So again, what do you think about these findings? Or do you think that these people that have recovered, that they that they can just go on with a merry life, or will they have permanent disabilities, permanent side effects for the rest of their life? And again, how about you? What illness have you had or disease have you had that caused you to change the way you do your daily life? Please leave your comments below. I want to hear. Hi. The small clip you saw was brought to you by Loyal World News. If you like what you saw, you should subscribe and look up my daily Loyal World News report for its full version. If you don't want to watch it on YouTube, prefer to be on the road, I also have a podcast in every full-length video I put up.